Welcome to our final How and Why vocal break. Again, my name is Corinne Jones, and today we're going to talk about drooling and Parkinson's disease. So, drooling is a commonly described problem in people with Parkinson's disease, but we're going to explore today what causes it and the how and the why we can address it. So, saliva is mainly produced by three salivary glands in the head. So one is the parotid gland, which is sort of on the side. One is the submandibular gland. So the mandible is your jaw. Sub means below. So this is below your jaw. And then the sublingual gland, sub again below, lingual, it means your tongue. So below your tongue. There are some other small salivary glands, but these three glands produce about 90% of our saliva. So saliva is a watery substance. It's mostly water, but it also contains some electrolytes, mucus, and enzymes. Saliva serves multiple purposes. When we eat, it helps moisten dry foods. It helps keep chewed foods particled together. It's actually also the first step in digestion in that it can break down the starches in some of the foods that we eat. It can clear debris from the teeth or the gums, helping to protect our teeth. And then it can prevent oral or overgrowth of oral bacteria. So it can some of the particulates in the saliva can help reduce the level of bacteria in our oral cavities. And then saliva can also be used for DNA testing or to predict or diagnose health conditions, including COVID-19. So salivary tests can be used for that. So saliva is pretty cool. And actually, in adults, we can produce up to 1.5 liters of saliva a day. That's quite a bit of saliva. So what happens to all of that saliva, simply put, is we swallow it. So this is just an MRI image or an MRI video of someone swallowing. You can see this is actually pineapple juice. So this is a larger volume than what we would swallow with saliva, but you can see how there's multiple structures in the throat and in the mouth that we can use to swallow it. When we're just sort of sitting there quietly resting, we swallow about once per minute. Just note during this presentation, you might swallow more often since we're talking about swallowing. Also, when we eat and drink, we swallow more often than 1 minute. But then also when we sleep, we swallow. However, it's a much decreased rate. It's about once per hour. Swallowing is what we call semi-reflexive. So there are certain parts of swallowing that work kind of like a reflex, and then some parts that don't. So in our oral cavity, when we put something in our mouth, we can put it in there, we can just leave it on our tongue, we can move it around with our tongue, we can chew it, you can chew on one side or the other, you can stop chewing, you can spit it out. So in our oral cavity, that's all under voluntary control. Once we're done in the oral cavity, we can move the food or liquid back into the throat or the pharynx. And once it hits a certain part in the throat, that starts a cascade of different events that are, that semi-reflexive type of behavior. So the soft palate will move up against the back wall of the throat, so food and liquid doesn't get out of our nose. The back part of our tongue will press against the back wall of our throat. The back wall of our throat will contract against the tongue. The airway will close, so we'll close our vocal folds. And actually, the whole airway moves up and forward in our throat. And there's a sphincter muscle that separates the throat from the esophagus, and that opens up. Lots of things happen in the throat during swallowing. That's mostly reflexive. And then once the food and liquid gets into the esophagus, we have no voluntary control of how that moves down. So overall, it's semi-reflexive. So then when we salivate throughout the day, saliva accumulates, and then when it builds up to a certain degree, it can trigger a swallow, particularly if it builds up in this sort of back area of the tongue. That's when we can trigger a swallow. Again, I'm going to play this MRI video so you can see all of the different components involved in swallowing. I could give a whole hour lecture on swallowing because I think it's so fascinating. So with drooling, research has shown that individuals with Parkinson's disease don't actually make more saliva. And in some of the research studies, the researchers found that people with Parkinson's sometimes make less saliva than otherwise healthy older adults. So what then causes the drooling? It's people with Parkinson's disease tend to swallow less frequently than otherwise healthy control participants. So what happens is that saliva builds up and it builds up and it builds up and it builds up and it must go somewhere. So one of the routes it can go is out of the mouth. It also could spill back into the throat or into the airway. So sometimes people also complain of a feeling of choking on saliva. Specifically in Parkinson's disease, so if someone with Parkinson's disease is not swallowing quite as frequently, there are other things that can result in drooling, namely posture. So if we have this forward posture, gravity is just going to bring the saliva out. Also, if someone has reduced facial expression, particularly with an open mouth, the lips can't contain the saliva, so it might spill out. And then also, if someone has difficulty swallowing, what we call dysphagia, then it can be difficult to get the saliva down, and so then it builds up and drools. So what can we do to reduce drooling? There are a few things that can be done. The first is just try to be more aware of it, just so you don't find yourself in a potentially embarrassing situation. You might have a friend or a spouse that could give you a little nudge and say, help in those kind of situations. Another thing that you can do is sip water throughout the day. So have a water bottle next to you, and if you drink water throughout the day, you'll swallow any saliva that's built up in your mouth or in your throat. Also, as we've talked about previously, you'll stay hydrated and keep your voice efficient and strong. Another tip that we sometimes work with people with Parkinson's disease is just suck on hard candies or chew gum. Sometimes that can stimulate saliva production, but then it also is associated with an increased rate of swallowing. So again, if we are swallowing more, then our saliva will get swallowed more as well. It's also important to address any swallowing problems you might have with a speech-language pathologist, or talk to a doctor about medical interventions. This is usually something that's done when all of these other things have failed to prevent drooling, but there are some medications or Botox injections into the salivary glands themselves that can help dry up the secretions. So again, people with Parkinson's disease don't create more saliva, they just don't swallow it quite as often. There are certainly things that we can do to help address that. I've been overjoyed to share this information with you guys this week. And please feel free to reach out if you have any questions, and enjoy this final day of the conference. And then we'll again meet tomorrow for some question answers. Again, it's just been a blast, and thank you so much.